evening, everyone. Thank you so much for being here. It's a great turnout for us. And my name is McKern. I'm the Artistic Director of Pensacola Opera, and I am thrilled to have this esteemed panel of what I would call the original stakeholders and boots on the ground of the AIDS crisis in Northwest Florida and Escambia County and Okaloosa County and Pensacola in general. And we have wanted to produce this opera 3 Decembers for many years, and we finally decided that we were going to be able to produce it this fall. We have booked the theater at the University of West Florida, so we're going. Some people think it's like going to Canada, but we're just traveling a little north. It's an intimate space, and the production is beautiful. And the piece is about a mother who is a famous stage actress, a musical theater actress, and her 2 children, Charlie and Bee. And really it's a piece about family trauma and how that plays out over the course of 3 Decembers, 1986, 1996, and 2006. Part of the thematic material is Charlie's partner dies of AIDS in the course of the piece, and his mother is less than sensitive about it to him. And so part of Charlie's struggle is dealing with, in the midst of the AIDS crisis, what that means to him losing his partner, how his mother's lack of positive support affects him. And so when we started talking about producing this piece, which there's much more thematic material than that, but we started to say with our dear friend and board member David Richbourg, he knows all the folks that were and was involved at the time the AIDS crisis was here, and no one knew what was going on. And so not only that, but we decided to bring out the AIDS quilts that had not been seen in Pensacola for 25 years.
Well, all of them haven't been, yeah.
So many years of the people from this area that quilts were made for. And so around that, we decided to sort of tell the story of how these folks affected our region and supported people that really had no other support. And I have learned an incredible amount talking to these amazing folks. And I had, the only experience I have is I was raised in Pelham, Alabama by my mother and her partner, now wife, and they've been together since 1986. And my mom got divorced, married, my mom's wife got divorced, and they moved in together and were roommates, and are still roommates. But of course we knew better. But my mom went to nursing school, and part of her practicum was working in an AIDS wing in a public health hospital. And so I remember her telling me vividly about a 17-year-old teenager that had contracted AIDS and was kicked out of his home, and she was helping to support that person. And I just called her the other day and told her we were doing this, and she talked for a long time about what it meant to her, at that time. And I thought she was I never heard my mom speak this way, but she said, people were scared at that time. She said, hell, I was a nurse. I always knew it was a little bit dangerous, but I didn't think of that. I just, I wanted to help people. And my mom and Mary were pretty active in the AIDS scene in Birmingham in the mid-'80s and the late '80s. And so, I respect what they did at that time. And so I'm very, very happy to be here with these esteemed panelists, and I want to introduce them. On the left here, we have Susan Walsh from the Red Ribbon Foundation. Welcome, Susan. Are they not? I think they're close. Yeah. We have, right. If you can't read, put your glasses on. We have Butch McKay, who is from OASIS. You were the former executive director, correct? And now you're the director of Positive Living, is that?
Positive Living Programs.
Positive Living Programs. And that's the Okaloosa AIDS Information and Support Services. And I have learned, my friend from the opera, many years that comes and, we joke and we laugh at parties, but Dr. Barbara Wade is I have learned a legend in the medical community, and particularly dealing with almost single-handedly as a doctor AIDS patients, and so we will love to hear your story. To my right, Barbara was with AHF, AIDS Healthcare Foundation, and to my right here, we have Mitchell Whitehead, Dr. Mitchell Whitehead, who is now, has taken over for Barbara at AHF. So welcome, Mitchell. And my very good friend, David Richbourg, who he and his husband Norman started a nonprofit called Appetite for Life, which was a group that fed AIDS patients and really was instrumental in keeping people as healthy and comfortable as possible. And so what we thought we would do first is I would like to call on each of these folks and have them sort of tell you their story, how they got involved, what those times were like. And I would love to start with Dr. Barbara Wade, and if you could tell us, you know, your experience, how you got into this, and how it impacted you in our community, that would be wonderful.
I'd be glad to. I first started seeing patients with AIDS in 1978 when I was an intern at the University of Alabama in medicine. Had not decided a specialty necessarily at that time. We didn't know it was AIDS at that time. We didn't have a name. We didn't know what was causing it. But we saw young, otherwise healthy-looking men with no previous problems develop these unusual, rare disorders. Things that were only rarely described in totally different type of patient. So through that period of time, from 78 till 1987, when I finished my residency, did my infectious disease fellowship in Virginia, kept seeing patients, more and more information became available, came to Pensacola in 87. During that period of time, we were fairly helpless to do much except treat these really weird infections. And sometimes we didn't even have medications with which to treat those infections. So all this knowledge was unfolding and more information was coming out all the time. But largely for that first 10 years, we just didn't have the tools to make a permanent impact. So it was sad times, horribly sad times. People talked about it as a death sentence, and it was kind of like a death sentence in a lot of ways. And then the social aspects of it, we were primitive. In those days, people didn't want to admit they were gay or lesbian, homosexual, and they didn't tell their families. If they did tell their families, they were ostracized and many times, and they had no support system. So there was that underlying social lack of infrastructure as well. So in 87, when I came here, I believe it was when the first HIV drug was available. It was called AZT in those days. And through the years, more and more drugs were developed. They were all of a certain class, and we used one at a time. And it was not until, as the years passed, it became known that it wasn't working. We didn't have any tests to figure out whether we were doing making an impact or not. Somewhere in there, we got what's called a CD4 test, which told us how damaged the immune system was. And that's fine. It went up for a while, and then it would go down again. Down is bad, up is good. Then, at some point, we got the test called a viral load. I think that was right around, I don't know the exact year, but 96 was the turning point of HIV. Again, the virus was discovered, they named it that, called the disease, full spectrum disease, HIV infection to AIDS. But we got the test called viral load. These tests were not invented yet. So with that test and all the knowledge, all the research information that was coming out, we found that we needed 3 drugs all at once, 3 different classes of drugs, kind of hit the virus at different points. that was referred to as the cocktail. You might have heard that term. So that was available. I remember I went to a meeting in '96, and that was what I heard. Came home, and these drugs were now there, and we started treating patients. Made them even sicker. It's terrible. They had a dozen or so pills just for the HIV problems they had to take multiple times a day. Terrible side effects. It was a bad time. Although the death rate plummeted in '96, it just was going up, and then it just went down. If a patient could tolerate these drugs, they did very well. But the tolerability was bad. So that's the first 10 years of the opera, I guess.
Yeah.
86 to,
yeah, right.
to 96. And then, so 96, new era, we could control it if you could tolerate the pills. So then the focus became find pills that did the job, that didn't make you so sick, or that were even better. Because the side effects, some of the side effects were just terrible. Nausea, vomiting, felt horrible, kidney failure, bleeding, and just very difficult time. So people were working, pharmaceutical companies were working on finding drugs that worked, but didn't make you so sick. And that started happening gradually through the years to the point where these days it's much easier. I just am happy that the information is, I think, largely out there. We're going to get the last decade, Dr. Whitehead, but information is out there, should be out there, so that people don't have to come back.
And Barbara, earlier you mentioned that you were sort of a one-man show. You know, you didn't have a lot of help. You were seeing patients, but you were taking files home. How did you become the singular person involved in helping so many patients?
Well, after I finished my fellowship, my first role in practice was in Baton Rouge. And I was the only infectious disease doctor there. And so I was seeing patients there. And then, not because I was the only doctor there, but my marital situation, we moved here to Pensacola. And there were two other doctors here at that time. One of them had been trying to take care of HIV patients, but he had, there's no coverage, so you're 24/7, 365 days a year. And he had the opportunity to leave town, so he left. The other doctor had coverage, but really was pretty fearful. I mean, he had a bit of a mental problem, thinking he was going to get HIV from just caring for patients. So I was the only one left, and of course I wasn't going to, deny that. The state asked me to help plan a solution to the problem of care, because the primary care doctors, they didn't know what to do. I mean, I always felt it was fortunate to start having to learn all this one thing at a time, because there was a lot to learn. And they didn't even have training in infectious diseases, let alone HIV. So they didn't would take care of patients, and the state had a little seat, and we started a clinic in Old University Hospital, half a day a week on Friday morning, and I did that. I don't know, a couple of years, a year or so, I'm sure. And it just became overwhelming. It's just too much. So when the Ryan White Care Act was passed, I don't know how many of you know about that, but it allowed government funds to provide some help for taking care of patients with HIV. So the clinic at University Hospital, where I had to take the charts home, didn't have a phone number, all that stuff. It was a real primitive situation in terms of the infrastructure. We did a health department. We called it the outpatient clinic in both locations, and we did it at the health department. And I was there, seeing patients there, but I had a little bit of, I had nurses, I had help. So, and then, I don't know, I can't remember exactly what happened. Oh, I know. So finally, I got a partner. So I went totally 24/7, 365 days a year. And with that, I was able to take care of patients in my practice. It was a private practice. But with the Ryan White Care Act funds, I could see everybody. You know, no insurance, Medicaid, whatever you had. So we did that. And then in 2014, I decided to join the AIDS Healthcare Foundation, and at that point I had 1,100 patients.
Wow.
And I just couldn't do it by myself. So I joined with them, and that's all I did. It was all outpatient. And that's how I happened.
One final question before we hear from other panelists, and I don't want to get too into the nitty-gritty here, but I imagine that it was a large mental strain for you to deal with not only something that people did, you were on the front lines and seeing, a vibrant community decimated, and how did that affect you personally and sort of emotionally?
Well, it was a sad time. I remember coming back from a meeting on the West Coast, and you get these syllabus, the last 2 pages are blank, and I started writing columns, names of patients who had died.
Yeah.
So many. But part of my job, and there were other healthcare people too, the nurses particularly, you mentioned the nurses, the healthcare workers in the hospital. They were traumatized by the deaths of these young men. And I was also in charge of employee health at Sacred Heart. So we started I guess you'd call it a support system for the healthcare providers. So they could come and talk about, their feelings. And maybe that helped me too, or maybe I was just still in the role of, taking care of that. But it was hard. It was hard for people. And it's still hard today to see somebody,
Sure.
down.
One of the things when I had our pre-conversation that I was so taken with is that at a time when there was such uncertainty and not many people willing to pitch in, I thought how amazing it was that all of you panelists here, but particularly in this story, were willing to step up and be the person that people can count on. So thank you for that. And we'll hear more from Barbara.
Like they say, it was my job. I'm an infectious disease specialist. It's an infection.
Sure.
That's the way it was. I had a very fulfilling, that's not all I did, other infections too, but it was very fulfilling. And I'm thankful that I had the opportunity to have a fulfilling career.
Great, thank you. Do you want to Butch?
Sure. We'll move on to Butch McKay. And Butch, if you'll just tell us a little bit about, what this was like in the 80s and 90s when you founded OASIS, and tell us your story about, how the HIV epidemic and the AIDS epidemic unfolded here in Northwest Florida.
Okay. Before I tell my story, I want to acknowledge this lady right here. In 4 counties. She was an infectious disease doctor. You know how rare that is in a rural community back in the 80s and 90s? There was no doctors in most rural communities that knew anything about HIV and AIDS. So we were truly blessed. And I think you need an ovation. No, we couldn't have done it without Barbara, that's for sure. I got my start, like Barbara, in Birmingham at UAB. Dr. Michael Sagg, who had the first AIDS clinic in Birmingham, was called 1917, because back then you didn't put the name AIDS on anything or nobody would show up. And they used 1917 because the address of the clinic was 1917 Fifth Avenue South. We only had like 3 exam rooms at that time. And this was back in '89 that I was working at the clinic as a volunteer. And you mentioned viral load testing. Michael Sagg and his staff at UAB is the one that developed viral load testing, and that's a milestone. So I was very fortunate to have as my personal mentor Mike Sagg, who taught me everything I needed to know from the research aspect and the medical aspect. And I represented UAB on 3 different international committees for AIDS clinical trials, for AIDS vaccine trials, and microbicide trials. So I got to go to all these national meetings and sit across the table from all the scientists and physicians that were developing the new drugs, that were working on vaccines. I served with Tony Fauci for 30-something years on several of his committees. So when I moved to Panama City, I had lived in Panama City right out of college, and I started losing a lot of friends in Panama City. And so in 1989, they invited me down. They were having this banquet, and they wanted me to come talk about my work in AIDS because there was nothing available in Panama City. Even Panama City people were either going to Tallahassee or all the way to Pensacola to see Barbara. And they had no case management agency, no services whatsoever. So I brought a team from UAB down and we did some training. And then we invited a group of them to come to Birmingham. We did additional training. And so in 1989, after the training was finished, we thought they just wanted a support service or a buddy program, but they had big ideas. And they became an agency, World AIDS Day 1989. And then in 1972, they finally got their Ryan White funds. And they invited me to come down and apply to be case manager, and I was hired as the first Ryan White case manager for BASIC in Panama City, which was the AIDS organization there. And I was there for 5 years, and I lived in Walton County all that time, and I felt a commitment to Area 1, and I knew that there was an organization in Walton at the time called OASIS, and they were struggling. They were getting ready to close their doors because it was an all-volunteer agency. They didn't really have the infrastructure to write grants. They didn't know that you could even write grants. But yeah, honest with you, they had started out in the trunk of somebody's car and progressed to a church that let them meet there. And so I went over and met with them to volunteer services on the weekend. Well, after a few months of doing that, they worked out a deal with BASIC where they subcontracted me from BASIC 2 days a week. And I'd work at BASIC 3 days and then OASIS the other 2. And then the following year, like 3 days at OASIS and then 2 days at BASIC. And finally, after we started writing some grants, I got enough money and brought me on full time. But at the time I started at OASIS, our total agency budget was $35,000 and they were paying me $12 as the executive director. And so we didn't have a lot to go on, but we ended up getting, there was a great program called Project AIDS Care. It was a Medicaid waiver program, and we got those case management services. And then we also later on got a subcontract from EASE that was here in Pensacola and was the lead agency in the Ryan White agency. They gave us a subcontract to do case management so our clients didn't have to make the 100-mile round trip to see a case manager. Of course, we still didn't have a lot of positions there, so they still were going far at that time. So, but one of the things that I saw, having had the training under Michael Sagg and some very progressive people in Birmingham, is what was missing in the Panhandle was education. People weren't aware that they could demand things. So we started looking at advocacy and how we could train people living with HIV how to become their best advocate. And this was very basic training. We had a program called Activate You Advocacy Academy. And we trained 5,000 or 6,000 people total. We even took it on the road outside the Panhandle because there was a big demand for it. But in that training, people learned how to not only find out who their representatives were, but how to contact them, how to do talking points, how to write letters, how to schedule visits with them, how to share their story. And that made a big impact. And so we started a conference in 1997 called Positive Living Conference for people living with HIV. That conference still is going, we'll have it next month. It'll be the 27th year. We usually have around 500 people. They come from all over the United States. It's the largest conference for and by people with HIV, meaning that 95% of the people that attend are HIV positive. And 85% of all the speakers are also HIV positive. And most of them got their first speaking engagement at that conference, so it's been sort of a training ground for them. But backing up a little bit, the reason I got involved, like so many people, particularly gay men, I lost my best friend. I mean, he was my soulmate. We've been best friends for 22 years. He had moved to Denver and I was still living in Birmingham. And I can remember it like yesterday. And January the 3rd, 1988, he confirmed what I already suspected, that he had AIDS. And it was at that time what they were calling full-blown AIDS. He was no longer just HIV positive. And he was in the hospital in Denver with pneumonia. And we started talking on the phone every day, and I saw him that March. He came into Birmingham for his father's funeral. And he was taking me to the airport to get a refund because I was supposed to fly out that day to see him when he called me and said, "Don't come, I'm coming to Birmingham." And so you would be familiar with Birmingham and Malfunction Junction.
Absolutely.
Well, his name was Tibbetts Bagger. What a name. But anyway, he was quite the character. And he said, "I need to talk to you about what it's like to live with AIDS." And I said, "No, I don't want to talk about it. All I knew that it was a death sentence and I wasn't ready to face that." And he goes, "And you're going to talk to me?" And I said, "No." And he said, he turns the car off in the middle of Malfunction Junction, takes the key out, car's honking the horn, almost hitting us, flipping us off. He says, "I'll move when you agree to talk." And so I didn't want to die that day, so we moved to the side of the road and spent about an hour talking. And he told me all these stories at the time I found hard to believe. I couldn't imagine parents kicking people out, people losing their apartments, their jobs, and everything. And it wasn't long until I found how truthful that really was. But he said, "I know you want me to come home, but you would smother me, and I can't handle that." He said, "I'm fortunate to have a good support network in Denver. And, but you can be there for me if you will promise me to be there for at least one other person living with AIDS that has no one." He knew me better than I did. He knew if I ever did that, I'd never stop. Made that promise 37 years ago. And I'm be 77 in November, and I'm still working every day in HIV and AIDS. That promise is just as real today as it was then. And Barbara and I were talking just a little while ago about, in the early days, nobody would embalm a body that had died from AIDS. Funeral homes wouldn't accept them. And when I was working in Birmingham, we had a young guy that died. His family lived in Mississippi, and they had no money to bring him home. Well, nobody would embalm him, and it's against the law to transport a body across state lines. So during those days, we did what was moral rather than legal. We put Leroy in the back of a red pickup truck, carried him across the state lines. He was to be buried in the church cemetery, but the church refused to let anybody that had died from AIDS be buried in the cemetery. So to this day, he's buried in his mother's backyard. But there were some horrible days back then. If you ever have a chance to go to my Facebook page, Butch McKay, and scroll down a little bit, there's an article called Tornado. And that describes what it was like with the patients. It was written by a friend of mine in San Francisco that's a long-term survivor of AIDS. And it's very graphic, I'll warn you, but it's really what we were facing all over the country, not just in San Francisco. But you think about at that time, all you heard on the news was New York, San Francisco, like it wasn't a problem anywhere else. But if you look at it from a population standpoint, statistically, it was just as bad here as it was there. Having been a Baptist minister early in my life, at that time no preacher would bury anybody that had died from AIDS. They wouldn't do their funerals or memorials or anything. So when I was at Basic, I was called on to do every memorial service of our patients that died. And I can remember one week doing 3 in one day. We were losing people at a astronomical, unbelievable rate back then. So I'm taking too much time, so I don't know who's next.
Well, thank you, Butch. That's part of what I was really taken with when we spoke is how what I'll call the fabric of everyone's participation when they saw a need and then filled it. And really where, I used the word earlier, but somewhat heroic in that, when no one else would, they saw something and said, hey, if no one else is going to do this, we're going to do this. And I'd love to toss it to David, that you and Norman.
Yeah. Well, I was very fortunate to be in a monogamous relationship with my then partner, later husband. So our friends in cities started getting sick, and we didn't know what they were getting sick from. We knew they were getting sick and dying. So we didn't know in Pensacola. I had not met Barbara, but I'd heard about her, Mother Teresa, taking care of everybody. And so I can remember going to dinner parties in the early 80s, and people fed us, all of us, not just us, on paper plates and plastic spoons and knives, because we didn't know. You were afraid to shake somebody's hand. You were afraid to hug somebody because you didn't know who had it, what it was, and how you get it. So we lived through those years, and then as medicine progressed, we learned more and more about it, and they came up with, was it 87 you had the HIV tests? What year?
HIV test is 85.
85.
Then we can say positive or negative, so that how we mix.
So fast forward, Norm and I were very fortunate to be good friends with Gary Little. And Gary's partner, and I'm sure you're going to talk more about this probably than I am, but it was only because of our association with Gary Little, and Gary Boucheron, his partner, had died and left some significant money in IRAs. And he said, I want to do something good for the gay community. Well, we kept hearing from EASE, which was Escambia AIDS and Services and Education, that they had such a need. Barbara could take care of them and give them the medicines available, but the patients were too sick to grocery shop or to cook. So, thankfully, because of Red Ribbon, we were able to start Appetite for Life. And Gary told me, and Vicki Bracco that's here, Vicki was dear friends of his as well. He told us, he said, I know you all will run it well. And he said, build your reputation and do what you need to do in this community, because you can't knock on the doors tomorrow and raise money in Northwest Florida for AIDS. He said, so you all take it and run it and make it into an organization with a sterling reputation. So I was president the first 3 years, and Vicki was vice president, and at term limits, she went to president and I went to vice. So we had one employee, Tyler Fitzgibbons, who has wonderful stories also in this community, and he was our chef, and used to work at the Driftwood, for those of you that are old enough to remember that restaurant, not many of us probably. But we had Tyler, and everybody else was volunteer. Everybody in the kitchen, all the people that drove the routes. We had people that were too sick to get up and answer the door, so they left coolers on their front porch for us to leave the meals in, and when they could get to them, they would get them out and heat them, put them in the refrigerator. And when we quit working, and when Appetite for Life closed in Escambia and Santa Rosa County, we delivered over 1 million meals. Wow. And I still run into people today that a few of them I remember, but most I don't, because I had my routes, but I didn't know all the people on all the routes. And in those days, they were pretty anonymous. And some of the people didn't want to open their door and receive the meals because they didn't want the driver of that route to know that they were living in that house with AIDS. But I run into people, not every day, but very often, say, you don't know me, you don't remember me, but I remember you feeding us, and with Barbara's medicine and your food, that's why we're still alive. So I'm very proud of having helped to run Appetite for Life and recruit volunteers and work in everything we did, from packaging meals to preparing meals to delivering. We had a great group of volunteers in this community, and we tried to feed people that Barbara was trying to keep alive with their medicines.
Thank you, David.
And next up, let's hear from Ms. Susan Walsh with the Red Ribbon Foundation. If you could just tell us some of the stories and the history of Red Ribbon.
Well, I got that, and I'm filling in for Josh Megan, who is under the weather right now, so if you've got a little prayer for him, please send it your way. He's battled some illnesses lately, and we all want him to get well and stay there. So if you'll do that, I'd appreciate it. But I am Susan Walsh, clinical psychologist by training. I retired after 25 years from the University of West Florida in the psychology department, where I trained undergraduates and master's level mental health counselors. So mental health and well-being and quality of life are sort of my disciplinary area. And I've served for more than a decade on the board of directors for the Red Ribbon Charitable Foundation. But that's only one of the many things that I have done since I came to Pensacola in 1999. And so I'd like to kind of broaden that perspective just a little beyond Red Ribbon. Red Ribbon is one player, and I'm proud to be associated with that. But I use the word player very intentionally. It's one player of many. You will see here, we have Dr. Barbara Wade is invaluable as a resource. And all we had, medically speaking, was Dr. Barbara Wade. And people struggled to get in to see her because HIV infections disproportionately affected marginalized communities, people who already had access issues. From the very start, people who had healthcare access issues were disproportionately impacted by HIV and AIDS. The LGBT community, the African American community, the trans community, people with substance use problems, people with incarceration histories, often the groups of folks that others don't typically stand up for, right? So while we're watching these advances go around and Dr. Barbara Wade running in magical circles to get these, magical things to people over time, which evolved into just great medical advances, there were people who couldn't get there. And having been in Pensacola for 25 years, I got to watch how our systems work and how each player in that system plays an important role. And I will admit that I fear tremendously as some of the resources that keep those systems together, that put the nuts and bolts kind of, connected to each other, are disintegrating. It's not all political. Some of that is made such great progress, people don't see the fire anymore. And, we can maybe be forgiven for a moment for thinking this isn't a problem anymore. Except that if we don't stay on top of it, like measles is reemerging, we can see this go back in time to some of the things that you've already heard about. And I started my work as a graduate student in inner city Philadelphia. I won't talk about specialized. It was an infectious disease OBGYN clinic. And that was in 1991. And I worked with women with HIV, women with AIDS. In 1991, I interviewed them for a research project and measured their neuropsychological cognitive functioning to look at HIV and AIDS effects on the brain in women back in the 90s. And these women were women with histories of domestic violence and abuse. They were women who had worked the streets or had drug problems, or just married women whose husbands ran around. Right? There were women across the spectrum, right, of the income spectrum, the socioeconomic spectrum, education spectrum, the whole 9 yards. And I was a woman, and there, but for the grace of God go I, who was HIV negative. Right? They didn't do anything different than I was doing as a young woman, and ended up with HIV. And in 1991, 92, 93, pre-protease inhibitors, it really was a death sentence. By the time you found out that you had HIV infection, life expectancy averaged 1 to 2 years. And I interviewed these women who told me, and I thought, oh, they're pulled, because I was 21.3 years old at the time, white girl, inner city, Philadelphia. I'm like, they're pulling the white girl's leg. Because my father was a surgeon, so I was a privileged young lady. I thought they were pulling my leg because they told me HIV was the best thing that ever happened to me. And I would cry, I cry every freaking time when I tell this story because these women moved me so much. They told me that this death sentence was the thing that saved their lives because they're going to get their kids back. The state took kids away from women with HIV. Just took them out because they had HIV. They were going to they got off drugs and went into recovery. They got off the street. They finally left that man that beat the crap out of them. HIV saved their lives. So this is a story not just of trauma and suffering, but one of resilience and strength, that the inside of these people comes out. And just, I learned life lessons as a young woman that I didn't have to walk those miles in my own shoes. People who came before me walked those miles. In inner city Philadelphia, we had some resources where women of all across the spectrum could get into care. I moved to Pensacola to find out that there are folks living in trailers, the water's cut off. There's no way, they don't have enough money to have bus fare to get to Dr. Barbara Wade's office. We get Ryan White Project AIDS care, and people have to get to a case manager to get connected to it. So we had people come across the table. For a while I served as chair of what was the Northwest Florida AIDS Consortium, remember that? An HIV prevention partnership, where we brought players to the table, OASIS, EASE, Appetite for Life, catered most of our meals. Dr. Wade and her representatives came to these meetings every month. We sat down with the Ryan White budget and we fought over nickels and dimes and pennies to try to make sure that people had bus passes, to make sure that they had mental health care, that they got substance abuse treatment, that they could stop injecting the drugs that contributed to their infection in the first place. And these things, we had nonprofit organizations. You were at Sacred Heart Hospital at the time. Before
What was it? I rented from Sacred Heart. I was independent.
And so we had private hospitals, we had nonprofit organizations, we had the health department. Everybody came to the table. We sat at these meetings. They got contentious. Woo-hoo! People called for the resignations and the firings, and we fought it out, and we got it done. And over time, I stopped hearing about people being unable to make it to the doctor. I stopped hearing about people being unable to pay for their Medicare. They got on the AIDS drug assistance program because we never gave up. We worked together and we never gave up. And one of those players is the Red Ribbon Charitable Foundation. It's a resource that most areas like ours don't have. Gary Bergeron and Gary Little were a couple back in the 80s, and when Gary passed away from AIDS and left a large amount of money to the local community, and we have a resource of funds, started out as humanitarian funds to turn the water back on in somebody's trailer, get them a taxi to Dr. Wade's office, buy groceries for a month, keep them from getting evicted, help pay the co-pays on their medication or their health insurance premiums so they wouldn't fall off of health insurance and lose all of their care. Over time, that consortium of players got together. We stopped having the humanitarian emergencies that we were funding. We started to be able to say, well, we need to fund prevention and education and make sure, do what we can to help people avoid getting into this spot in the first place. And so there was a lot of activity to help people adopt condom use, minimize their partners, at least use clean needles, if not, abstain from injection drug use, make changes in their life. Before we had PrEP and other medical ways to prevent HIV, make changes in their lifestyles so that they could avoid getting HIV, particularly for people who had an HIV positive partner. And if you were in a partnership and one of you had HIV and the other one didn't, it became really important one of the things that happened after 1996 was we learned that when you get that viral load down, and you keep it down, you're no longer infectious. Treatment prevents HIV from transmission to other folks. So we need to keep treating people with HIV so that they can live long, healthy, wonderful lives. And also so that they're not transmitting it to their loved ones unintentionally, of course. We also now have pre-exposure prophylaxis, tremendous advancement, whereby one can take a medication, and even if you're exposed to HIV, your body will not become infected by that exposure. Not only do we have that, it used to be a daily medication, and I did a lot of work as a behavioral psychologist trying to get people to remember to take their medicine every day. Like, you think that's an easy thing, but just ask anybody who has hypertension, how many times do you forget to take your blood pressure pill, right? So, we worked on medication adherence. But now you can get PrEP, you can get 2 shots a year. We get it to once a year, and we can really tackle this thing. We could win this if we don't stop. So I hope everybody who's here, who maybe isn't familiar with that history, will realize that if we stop doing what we've done, that we will go backwards. And this, what was an epidemic and very scary and catastrophic, and people wouldn't bury folks, people wouldn't touch folks. I lost friends out of fear of contagion. And they just said, you work with AIDS patients? I'm not coming anywhere near you because I worked with AIDS patients. We could go back to that if we stop. So I hope you will convey the message that we can't afford to stop. We need to carry on. I'll get up the soapbox now.
Whitehead, in our pre-meeting I asked a question about politics at the time with Reagan, and I was somewhat surprised that this group of esteemed panelists really didn't take that bait. I was hoping for some, yeah, that asshole. And it occurred to me after I got off the phone that, they were too busy and too in it. And it occurred to me that things that are controversial are only political if you have no idea anything about it and are unwilling to learn. And so these people were willing to learn and help, and I think that's a miraculous part of the story.
I would also add that historically this problem has been big enough that there's no easy answers. So it's very easy to get mad at all sides.
Sure.
It's just, might get more mad at one side of the aisle or the other, but it's very easy to get mad at all sides because no leader is going to be able to do a perfect job. We still have HIV and AIDS, hence there's plenty of people to get mad at.
Sure. Thank you. So having taken the mantle from Dr. Wade, can you tell us a little bit about your participation with AHF and what things are like now?
Sure. Well, first off, none of this could be possible without everything you all have done. So, sure. None of this would have been possible without all the work that Dr. Wade, that David, that Butch has done, Susan, Josh has done. Like, these people laid the groundwork that made my job much easier, and I'm very thankful for that. Today, if we look at the HIV epidemic, and I still use the word epidemic because it is, in the South, 1 in 5 people living with HIV do not know they have it. So there's still a lot of work to be done in the Southeast. Our current census at AHF is around 1,500 patients living with HIV. We also have several hundred on PrEP. Myself, Brett Franz, one of our nurse practitioners who's here tonight, Hillary Rojas, we sort of manage those patients together, and to this day, unfortunately, we still see 4 to 5 brand new patients a month. So even in our small area, we still get brand new HIV cases. We get people who've moved to town who are positive that are coming to see us for care. The world is much different in a better way because of the medicines we now have, thanks to a lot of the research that my colleagues like Dr. Wade have done. If you're HIV positive, most of our patients can take a single tablet and they're okay. Their CD4 cell counts recover, their viral load is suppressed, We hope they will live a long, happy lifespan without the horrible opportunistic infections and the detrimental effects of the AIDS syndrome. We also have new medicines and tools at our disposal, like Susan had mentioned, such as injectable PrEP. A patient can come see us every 6 months and get a shot to prevent HIV. If you're HIV positive, we now have a version of that shot that will be coming out hopefully in the next few weeks that'll be every 3 months. So we have some pretty amazing tools now. The issues that we are currently having are barriers not like we've seen in the past, where patients can't get to the doctor's office. We're having barriers such as insurance troubles. This past week, I had a 12-year-old who sat on a seat with his dad of a Delta airline, and he sat on a dirty needle. We have 72 hours to start prophylaxis. So it's called post-exposure prophylaxis. If you're exposed to HIV through sex or a needle, you have 72 hours to take the medicine. This little boy was from Chipley. The pharmacy in Chipley could not figure out what to order, what to get. Luckily, they were sent here to Pensacola. The dad drove here, and our pharmacist cried on the phone for 3 hours with, I can't remember, it was Blue Cross or Delta, whatever insurance they had, because they wouldn't approve this medicine for a 12-year-old. So we took it off the shelf, and hopefully no one gets us in trouble, but we just did it. The dad was about to pay the $4,000 that it cost for the 1 month supply. HIV drugs are incredibly expensive still, and many insurance companies don't like to pay for the newer drugs. They like to pay for the old drugs that caused a lot of horrible side effects. So that's a lot of the battles that we fight now, are things like this, including access. Brett and Hillary lead one of our mobile units. We have an RV that goes out to the small rural communities where many people living with HIV don't feel comfortable talking to their family doctor or to their healthcare providers in their community. They've met patients in tents. We have a patient that lives in an RV that was on fire outside of Cottondale a few months ago. We take care to the patient. And one good thing about AHF is we take care of the patient regardless of their ability to pay. So we accept Ryan White, we accept state funding and grants, so we can pay for these expensive medicines. We can pay for their visits, their labs. But that could change if these grants are threatened or if we no longer get Ryan White money. So I appreciate Susan bringing attention to that. Because you're right, without some of that funding, we are in danger of people no longer being able to get this medicine that can save them. But if they have access to these medicines, these people will be okay. And this is something that affects our community. There are many here in Pensacola with this condition, and we see it every day here.
Thank you.
In addition to all the community, straight and gay, stepping up to help us deliver meals for Appetite, before Appetite ever opened, this community stepped up. We had people like Jim Goldman that started Art Against AIDS, which was a huge fundraiser. There were many people in the community that just did all of their little things that they could do. We had people driving routes at Appetite for Life. They got to know their clients on those routes, and the ones that could afford to, they wound up paying power bills, and I know one that paid the funeral expenses for one. So our community stepped up in many ways to help this group of people do what they were doing to try to save the lives.
Well, first of all, before I ask a couple follow-ups, how about a big hand for all of our panelists? I would be remiss if I didn't say opera at its best is stories of the human condition overcoming tragedy and the heroism of that. And there are just multiple stories that we've heard, not only from each of you, but about the people you've discussed. There are so many operatic scenes that you have set up, and our art form, part of what I fell in love with is that focus on the human condition and the individual. And so this has been incredibly enlightening for me. One follow-up question that occurred to me, when you said, Dr. Wade, between 86 and 96, there was so much new technology and innovation. I believe Magic Johnson was diagnosed in 92. Did that have a major effect nationally on turning the tide of public opinion or research, or?
I don't think so.
I don't think so.
I don't think so. I don't think so. I think one thing that had an effect on during the time was just the times. People, general public, not too long ago, I was trying to think how many years ago it was. My private practice, the HIV part of it, which was still the private practice, applied for an Impact 100 grant. I was a member of the Impact 100, I still am, I believe in it. But when you apply for a grant, they come to the site and they ask you questions. And of the, I don't remember their names, I don't know how you guessed them, they just, I guess, just didn't know. But they kind of said to me, well, so I'm paraphrasing, don't these people deserve it? What? What? So, yeah, don't want to turn you off against that organization, so just 2 or 3 ladies who came. I think it's a really good organization, but people, they don't, the attitude was going away. And I don't think it was just Magic Johnson. He's a miracle, brother. He is.
Sure.
But, so that's genetic. You know, there are some people, very, very few, who just are resistant to getting HIV. Just don't ever get it.
Right.
But the times are part of it. What was the question? I got off track.
I was just curious, you know, because he was the first public figure. Yeah.
Well, we had prominent families in this community whose sons died of AIDS living away from Pensacola. They didn't allow the body to come back to Pensacola to be buried. They didn't want to deal with it.
I have a personal story that I don't know whether I should share, and I will share it. My first husband's father died of HIV from a blood transfusion in New Jersey when there were only 655 blood transfusion cases in the United States. And even though the man was a pillar of everything, if you think about, not that gay people aren't a pillar, but you know, I'm trying to say there was no reason to criticize the man, but the family didn't want that to get out. They didn't want to get out because of the prejudice and the stigma and all that.
Wow.
So that things had changed.
Sure.
And now it's different, but I don't know what to say. And of course, the tennis player, Arthur Ashe was a blood transfusion.
Right.
But he did something good, you know, the Arthur Ashe Foundation.
Sure.
Yeah.
Well, another thing before I open up questions from our audience, you know, I want to thank you all for sharing what can't be easy stories, so thank you. Any questions for our group?
Or do we wear you all out?
Just to throw something out here, Barbara, Susan, David, you know, we're displaying the quilts. And I know a bit of the story. We found the quilts at our storage facility at AHF, and we've been trying to piece together some of the stories. And if any of you, after this, know some of these individuals on the quilts, please let us know. But do one of you know how the quilts started here in Pensacola? I thought it was a Girl Scout troop. I don't know who actually started them here.
I'm sorry, I'm hard of hearing.
Do you know who started the AIDS quilts here in Pensacola?
I don't know
Who started the, it was kind of an organic thing, it was a national initiative, and just local
families. There was a family, families.
Friends and
Yeah,
families started
families.
making them, and there was a Girl Scout troop. We had those quilts when we unpacked them, we found them.
I mean, these.
There are quilts that were made by Girl Scout troops, but in the very beginning, it was friends and family. And many of these quilts have a picture or the name and the dates of good death and all, but they're signed by a multitude of friends. And many of those signatures are people that are still alive today.
The quilt here in Northwest Florida is a little bit different than the national quilt. The national quilt, each panel is 3 by 6, which is the size of a standard grave. In Northwest, ours were 2 by 4 that we did here in the Panhandle.
I just remember that it was a way of the loved ones, friends and families, to put something touchable, something, you know, to remember their loved one. And we would display them. They would be displayed that way. I really wasn't involved in that, but I was there when they had these events, like World AIDS Day and other events, the Arnega's Days, I always went to that. So,
Nationally, it was started by Cleve Jones.
But it was a diffuse initiative, like the families made a quilt panel, and the quilt panels would be gathered and put on display at events like World AIDS Day. And so people would be like, I want my quilt for my loved one to be in there. So it wasn't, there's not an organization or an individual responsible, which again kind of gets to that, the community coming together and forming this patchwork of services, but also the quote really symbolizes that quite nicely.
Yeah. Questions? Don't be shy.
Well, how about a statement and a thank you to David and to Mitchell for putting these panels back out into the sunshine.
Yes.
They've been watching.
Yeah, and thank you to the founder of Lavender Riots, Stephen Mack, who has also been very helpful for us. He's also started an initiative for 3 Decembers where he will either buy a ticket for you or match the ticket buying. And so Steve is a new friend and has been jumped right on board and been incredibly helpful for us. So I hope he's a friend of the opera for a long time.
And you all will see in the lobby at the university, Steve, we're bringing one, I don't know the names of them, but it's a container. Up until now, they've been stored in plastic totes. And Steve has found a container that will preserve the fabrics and not let them deteriorate, because they're still in great shape. But we're lucky that they are, thank you to the people that packaged them up and kept them all these years. But there's a QR code on the one that will be on display in the lobby, and they're taking donations to buy enough of these crates so that we can store and preserve all of the quilt panels.
Can someone speak on Art Against AIDS?
Art Against AIDS, how that fundraiser started. And
Vicki, would you like to talk about that? You were in the trenches with that in the beginning.
Art Against AIDS was started by Jim Goldman, who was larger than life in so many ways. People think when they were kids run off to the circus. Well, he did, and he was. He was a circus performer. And he was an interior designer, and he had tremendous talent, and he had a personality that was as big as Wyoming. And it started at the executive club with tiny little tables with silent auctions, and they would have a theme. And one year it was chairs. So artists would would paint chairs. I have 2 of them in my house that you buy and bid against. And then one year it was wardrobes. And Chip Spearson was always someone and Pat Regan, always the same artists who would come and do whatever, boxes. It was always something different. And then it got so big that it really was a circus. And the performers came, and it was outside, and it was monumental. And it was the most fun party that you could spend your money at ever in town. And we owe Jim Goldman a tremendous thank you for getting the people in, I don't want to say society, but the people who were away, insulated from the terrible stories that you're telling, and whose kids held their secrets, and families who didn't, and the education that came from it, the arts community that came together, the theater community that came together, and it was all because of Jim Goldman. And that was Art Against AIDS. And I wish we still did it, because there's always room for another piece of art. Always.
Well, back at that time, we had to depend on, like Whitehead and other organizations, the bars that were doing fundraisers constantly. The first 10 years OASIS was in business, 90% of our budget was raised at Brinkley Scarlet, which was the gay bar at the time in Fort Walton. Because we had no state or federal funds for those first 10 years. And, you know, and over the years, there's been other groups. You know, we used to have a lot of good relationship with hospice, home health care. There's not a need for that so much anymore, which is wonderful. But in the early days, we depended on them, and we had relationships with every one of them. You know, there was so many community partners that we don't have time to mention maybe all of them tonight, but it wasn't just the people at this table in our organization. There was a village of people doing stuff, so we came together. And I think it's important to know how the impact the Panhandle has also had on national policy. A few years ago, they were going to cut the ADAP budget, which is the Age Drug Assistance Program for people living with HIV to get their medications. They have a formulary, and they were going to take several drugs off that formulary that people needed that they couldn't afford to buy. And before they did that, they had a series of town hall meetings all around the state of Florida. Well, we partnered with AHF. They released a whole bunch of buses for us. We packed those buses and went to Tallahassee. There was a town hall in Tallahassee, one in Fort Lauderdale, one in Tampa, one in Jacksonville, I think Orlando. There was 5 of them. And we had so many people on those buses. We were the largest contingency in the entire state of Florida. In fact, they had told me, I told them we were bringing a group, and they didn't believe me. They had this room about half the size of this one. And it was so small, they had to empty the room, and the next group of people would go in. We sat there for 8 hours that day. It was 4 groups of people, and it was clients who had never in their life stood up and spoke about having HIV. And everyone on every one of those buses got up that day and told their story and how cutting those drugs would impact their life. And when they went to the other town hall meeting, we were the first, they actually called me and said, because of the Panhandle, we're not going to change the policy. Y'all have the biggest, strongest contingency, and when those people got up and told their stories, we realized we could not do this to them. So the Panhandle has played an important role. When the National AIDS Strategy came about, they had town hall meetings, and they said they were doing some in rural communities, and they had one in Jackson, Mississippi, and another one in Atlanta, which certainly isn't rural. And they said, well, Jackson's rural. I said, they have an airport. Everything that's an airport is not rural. You know? So we sent people to Jackson, Mississippi. We sent people to Atlanta. So the voices of rural communities would be heard and be a part of that strategy. I took it upon myself. I met Jeff Crowley, who was the director of ONAP, the AIDS policy under the president. And I scheduled 3 meetings, one-on-one with him in DC, to make sure that rural communities were not left out of that policy. And one of the proudest moments of my life was I got invited by President Obama to come to DC the day that strategy was released. There was two representatives from each state from the community, and then there was scientists and researchers and stuff, but 150 people total. But so the Panhandle's played an important role, and we can't say that we haven't. You know, we had town hall meetings, and Barbara Wade can tell you, when we first started and she was seeing patients, she was getting paid like half of what somebody in Miami was getting paid for that same patient. There was no equity in patient care, and we lobbied for that. And we had Tom Liberty at the time was the State Health Department Director of HIV and AIDS, and we had all these town hall meetings to demonstrate that we needed more money, that we needed the same per person that Miami was getting. And I don't think we ever quite reached that, but we got so close, it made a big difference. And so we have to be proud of ourselves for what we did.
Well, you know, most private medicine is fee for service. You come in, you do this, you get paid a certain amount. What the Ryan White Care Act funds allow, I didn't know what I was getting. I didn't get per patient.
Yeah.
I said, you give me the money, I can manage it, I can take care of these patients. And it wasn't allowed. Some rare patient would say, you just want me to come back so you can get more money. No, I didn't get more money if you came back. I just took the patients, And I took the money that was available, and thanks to all of you guys for sure, maybe you guys for sure, to help us get the money that we needed to take care of patients here. So, but thank you for that. But that wasn't fee for service. It was do the job,
Well,
take what
you were in a
money.
clinic-based setting,
Yeah.
like when I was at Basic, it was all individual physician, and that was
Yeah.
per patient.
I want to jump in here and, Butch has just told you about how important the Panhandle has been. I want to say that he has been one of the most important voices in, when President Obama invited him for the unveiling, it's because, his connections to Birmingham that started at day one with him. He served on the vaccine advisory boards. He was a community advisory board member, making sure that informed consent was readable by patients who participated so that they weren't exploited in research, making sure that the research ethics were completely in place as a layperson. He served on the President's Council for on AIDS and aging or some, how long those titles are. So he will downplay his contribution and praise Dr. Burwade. The two of them have played incredible roles in our backyard and far beyond that. And like I said, it's been a whole team and a patchwork, and it takes all of that infrastructure in order to get people where they need to be in order to benefit from the technology. You can have the cure to cancer in your pocket, but if you don't administer it to the person with cancer and you don't feed them, that cure is no good, right? And so we have wonderful resources for HIV now, but I know that CDC, which used to send, the funding sources that we were talking about used to be, there would be federal dollars that flowed through the Centers for Disease Control, some directly to states and localities. And for a time we benefited from that. And then they said, nope, just major metropolitan areas, and we lost the direct funding. But for the very longest time, the CDC got a big pot of money and they divided up, Florida gets this money, and Tennessee gets this money, and state by state, there was money to fund things like the Brian White Care Act, to fund prevention, to fund other initiatives, and we are seeing the Bureau of HIV lose its at the CDC and at the state and local level. The personnel are no longer there. Those positions have been cut down to a bare minimum. So there are fewer people doing the work to keep this ship afloat. I'm going to get a little political now and say that the work that those colleagues of mine did over the 25 years that I watched qualified as none of the above of waste, fraud, or abuse. None of the above. It was critical services that needed to be delivered. There was a lot of pencil pushing, there was a lot of fighting, there was a lot of griping. There was obviously mistakes that were made, and there was never enough to go around. Never. But right now, we don't even have cooks in the kitchen. And I worry, and the funding, the state funding is kind of cut, and so are the Brian White Care Act is going to be Part A and Part B only, Part C, Part D. Just suffice to say that the different parts of the Brian White Care Act have different functions, and one of them, Part B is sort of the broadest function, and Part A gets to your major cities, but Part C and D get rural areas, get minority initiatives, etc. And those are being taken off the table if we don't fight for them. We almost lost PEPFAR. You may think, well, that's outside of our boundaries. But I did some work in HIV before I came to Pensacola in Vermont and New Hampshire. I lived in Vermont and drove 2 miles to New Hampshire across the bridge. There's a river between the two states, and to go to work every day. You know, I worked at Dartmouth, so I lived in White River Junction, Vermont, and drove to Hanover, New Hampshire on a daily basis to go to Dartmouth for work. And the state funding for Vermont and state funding for New Hampshire were very separate. You can't spend dollars in Vermont over in New Hampshire. We're 2 miles away, separated by one bridge and a river. And we used to say the HIV workers would say, look, rabies won't cross the river, but HIV does. HIV doesn't see that river. HIV can drive over the bridge. Rabies, hydrophobia, rabid raccoons they won't swim. But people get in cars, and HIV crosses those boundaries. It also crosses international boundaries. And so if we're not assisting the epidemic worldwide, it'll make it here. We've seen it with other pandemics. Just a warning.
Big hand for our panelists here. Feel free to pass the line, and if you do have any questions, I'm sure our panelists wouldn't mind you coming to them. But thank you so much for being here.